Our Province COVID-19 briefing is a regular panel of doctors and experts that address questions from the media and viewers at home. We are live streaming from the traditional and ancestral territory of many peoples. Within a cross-Canada digital landscape, we wish to take time to acknowledge all the Inuit, Métis, and First Nations people that call this land home. Please take a moment to reflect on your relationship with the people and the lands on which you are currently situated. Today's conversation is being shared in English and in ASL. To ensure access to completely accurate information, closed captioning will be uploaded after the live stream is complete. This national conversation for the public is being shared live on YouTube, Twitter, and Facebook. We are hoping to create a French language translation as well. If you are interested in regular information in French, please also tune in to our sister broadcast through Pop Quebec. Details can be found at www.popqc.ca. The views of our panelists are their own and do not represent any institutions they may be affiliated with. We have collectively gathered here as concerned Canadians, attempting to ensure that everyone in the country has access to as much information concerning COVID-19 as possible and the nationwide impact of regional policies. From wherever you are joining us, thank you very much for being here today. We're going to be doing a focus on the prairie provinces, particularly Saskatchewan and Manitoba, similarities in their responses, differences, and what is happening currently on the ground in each jurisdiction. With us today, we have some excellent panelists, experts from both Saskatchewan and Manitoba. I'm going to take this opportunity to bring our panelists into the conversation and allow them to introduce themselves, and then we will move on to some more detailed information on those jurisdictions before taking questions from the public and the media. Thank you guys so much for being with us. Maybe we'll start with a little bit of who you are and what your lens is with Dr. Wong, and then just proceed clockwise around the crew.
Thank you, Michelle. My name's Alex. I'm an infectious disease physician in Regina, Saskatchewan, Canada, and I'm an associate professor with the University of Saskatchewan. I'm pleased to be here and to provide facts, evidence, and my interpretation of the current situation regarding COVID-19 for the province of Saskatchewan to this group. So thank you for joining us.
And I think I'm next. Thank you very much, Michelle. I'm Dr. Gillian Horton, and I'm a specialist in general internal medicine, and I practice in Winnipeg. I'm an associate professor at the University of Manitoba in the Department of Internal Medicine, although, as you noted earlier, I speak for myself and my opinions are my own. I primarily do clinical practice in the area of people living with addictions, and I hold a number of administrative and teaching roles as well. And along with a group of colleagues, I have been active speaking out since the time that we first began experiencing tension between our systems and a lot of the direction in terms of how the current crisis has been managed politically by our governments.
Great. I'm Dr. Christine Peshkin. I'm also at the University of Manitoba. I'm a professor of rheumatology and community health sciences, and I'm part of the group that Jillian has been talking about. I come at this from a slightly different view. I mean, most of my practice is chronic care medicine. I deal with patients who are immune compromised and therefore have been very vulnerable to COVID right from the beginning, and are now very vulnerable when it comes to the delays and the shutdowns in the healthcare system. And that's been my primary focus and lens during this pandemic.
Thank you all so very much for taking the time to be with us today. I know that this last 2 years has been more than exhausting for everyone who is on the ground, particularly in healthcare settings. As we begin our conversation today, I'd like to start by focusing in a little bit on Saskatchewan. So I'm going to pop our Manitoba panelists back into our green room. Dr. Wong, would you talk everybody through what's happening currently in Saskatchewan?
Sure. If you want to pull my slides up, Michelle, we will begin. I'm just going to probably try to take like 3 to 5 minutes just to provide everybody on the line with a brief overview. We'll go through the statistics, or at least the daily statistics, in just a moment. But in brief, Saskatchewan's been quite unique with regards to Canada in its approach to addressing COVID-19. As far as I know, we are the only province at this point in time, the only mainland province that has no public health measures in place other than for an indoor mask mandate, as well as proof of vaccine status. The mask mandate came into place in mid-September and proof of vaccine at the beginning of October. There are no capacity or gathering limits or restrictions at this time. Earlier today, there was a press conference held by our health minister, Minister Merriman, as well as our chief medical health officer, Dr. Saqib Shahab, indicating that there would be a universal 5-day isolation period for all individuals who test positive for COVID-19. And at the same time, hang on a second, that we would be eliminating close contact isolation. So if you are named as a close contact of COVID-19, regardless of your vaccine status, you do not have to isolate any longer for any period of time. You have to self-monitor and isolate only if you have symptoms. That will go into place as of tomorrow. There's also been messaging from our premier over the last week indicating that current measures, including our mask mandate as well as our proof of vaccine program, could potentially be relaxed or removed relatively soon, although there doesn't appear to be a clear timeline with regards to that. And he's also indicated in previous announcements beginning early last week that he felt that lockdown measures, as the term that our premier uses, have been harmful without clear evidence of benefit. And he cites Quebec's current situation and high hospitalization, ICU admission situation, as well as high death rate, despite having very aggressive measures in place, as being an example of this. Here in Saskatchewan, unfortunately, our hospitals and ICUs are filling up very, very quickly. We'll show the graphs in just a moment. But there's major pressure on our acute facilities in Saskatoon and Regina where patients are funneling. And it does appear in general as though our Omicron wave has started initially in the large centers, Regina and Saskatoon. The wastewater signals would suggest potentially that we're starting to peak in those settings, but we have yet to peak in rural Saskatchewan. So with all that said, Michelle, if you want to move to the next slide, please. So I just stole some charts here, some nicely put together charts from a Twitter account, OK Arbiter. He or she has been present on Reddit for a number of months now and has helped to put all of our data together in a simple and easy to interpret sort of graphical format. So again, what we can see here is very high case rates, a test positivity rate of somewhere between 30 to 35% per day, which is, I think, the second highest in the country, only behind Manitoba. Deaths are increasing, and obviously our hospitalizations and ICU numbers are also increasing quite rapidly. Next slide, please. Just moving here, like I would ask that that everyone focus on the second graph sort of down below. This essentially, you can see in the green, this is our case count. Again, there's a certain skew here, obviously, with limited access to PCR testing and so forth. But again, you can see this lag between the green curve and the red curve in terms of our hospitalization numbers. And you can see right now that we're on that unfortunate sort of exponential growth curve of our hospitalizations. You can see that our peak hospitalization numbers were back in the fall when we had our horrible Delta wave. There were about 350 some odd people hospitalized at that point. We look almost assuredly to exceed that probably in the next day or two here in Saskatchewan. And we also see an uptick here in the yellow of persons admitted to the ICU as well. Next slide. Just to highlight the fact that we have incomplete data from our ministry with regards to cases by vaccine status, hospitalization by vaccine status, and as far as I know, there is no data that exists at this time with regards to persons admitted to the ICU and their vaccine status as well. Next slide, please. Lastly, just to talk very briefly about our vaccine uptake. Unfortunately, Saskatchewan lags most of Canada with regards to overall vaccine uptake. I believe if we look at all of the mainland provinces, that we are probably second last, unfortunately, only ahead of Alberta with regards to overall vaccine uptake. And like all other provinces, our booster uptake has slowed. And again, I mean, it's a bit of a struggle at this point in time to work on figuring out ways to get that higher. Next slide, last slide. Lastly, just to highlight the fact, if we kind of move here to the last graph here at the bottom, just looking at the overall uptake in our children aged 5 to 11, It's been modest. For me personally, it's been kind of disappointing. We only have a little over 50% of our kids aged 5 to 11 who have had their first dose, and a little over 25% who have been fully vaccinated. It is worth mentioning that here in Saskatchewan, I think we were one of the only jurisdictions in the country that allowed there to be some degree of parental / caregiver choice with regards to the interval between first and second doses. So that again is part of what may play into some of the numbers. But overall, we've had a lot of challenges in terms of vaccine uptake, particularly in rural Saskatchewan and in on-reserve settings. So we obviously need to continue to work at that. So bottom line, suboptimal vaccine uptake, the least sort of aggressive public health measures in the country. And we're right in the midst right now of, unfortunately, a significant surge in hospitalizations and ICU admissions. We do anticipate that, unfortunately, things will get worse for our hospitals and our ICUs probably over the next couple of weeks before they get better. And we expect to see some surge in rural Saskatchewan in the coming weeks as well.
Thank you so much, Dr. Wong. Just as a quick follow-up before I bring up our Manitoba panelists, you'd mentioned a little bit about your wastewater surveillance currently happening in Saskatchewan. What is the testing criteria in your jurisdiction right now for PCR and or rapid test access?
There is still a recommendation, Michelle, for persons who are symptomatic to access a PCR. On the other hand, if you have already tested positive on a rapid, it is not recommended at this time that you confirm with PCR. PCR testing has also been reserved, obviously, for higher risk type settings and groups, for example, healthcare workers, congregated living settings, and so forth. And there is some discussion around prioritizing, for example, persons who are eligible for early treatments like the new oral antivirals, as well as the monoclonal therapies.
So as a regular citizen, say that I were currently living in Saskatchewan and I was feeling slightly unwell, would I be able to freely book a PCR test, or is that currently only available for healthcare workers and high-risk groups?
You still are able to go and line up to access a test. I don't believe that you can easily book an appointment in any sort of timely fashion. If there's one thing that Saskatchewan has been better at than other provinces, including Manitoba and Alberta, it has been access to rapid testing. There was a lot of pressure on the government, I think, to roll out rapid testing with our Delta wave back in September. There were some hiccups, but we've been able to actually roll out rapid testing quite well. And so accessibility to rapid tests for people that have access to things in general has been generally quite good. Access to PCR testing is still very, very limited at this point, but you still can line up. You'll just have to wait a few hours.
Thank you very much for clarifying all of that. It's one of the things that I've noticed is a large jurisdictional difference throughout the country in terms of what level and what access of testing folks have available to them in order to see if they are actually contagious and ill, or whether or not they're just feeling slightly under the weather. I'm going to pop you backstage again, Dr. Wong, for a few moments, and I'm going to bring up our team Manitoba, and then I'll bring you back into the conversation. Hello. Thank you both again so very much for being with us. Could you just give anybody watching a little bit of an overview, conversationally, take your time, talk back and forth around what is happening in Manitoba and how that sort of compares to what we just heard from Dr. Wong in terms of what's happening in Saskatchewan?
Sure. Thank you so much, Michelle. Well, maybe I'll start because I think I drew the straw for who appears on the screen clockwise first. A lot of similarities between what is being described in Saskatchewan and what we are experiencing here in Manitoba. High hospitalizations, a record high, around 711, I think, as of the last posting. 51 patients in ICU, which again, we are at or near a record for these last 2 years. So really, when we look at what's happening in the hospitals, we do see the most activity that we have seen throughout the entire pandemic. In terms of a few of those other metrics, as Alex mentioned, we have the dubious distinction of the currently highest reported test positivity rate, I believe, in the country. A few things that confound that, of course, as testing becomes more limited and more targeted and varies across provinces, it can be hard to know what to make of that number, but certainly remains exceedingly high. Some of the data that we would like to have more access to, so for example, wastewater data, we had some coverage of this in the last couple of days, telling us that 3 out of 4 sites being sampled showed the highest peak. Probably for us was sometime right around or after New Year's Day. But again, that data, the way that it is shared and presented, and what we know about it, really makes it difficult for us to begin to interpret it. And just one other, significant question mark, I think, for all of us is we don't really know yet the degree to which Omicron has made its way into some of the areas of the province that are relatively under-vaccinated compared to, for example, Winnipeg, where we have over 85%, I think even better than that now, of the population that is at least double vaccinated. Just looking on the Manitoba dashboard as it is reported, if we look at our population of eligible folks being about 1.3 million, about 500,000 of Manitobans who are eligible have had 2 shots, and another 500,000 have had 3 shots. So just to give you a very general picture, but we have lots of areas of the province where the 2 and 3 dose and no dose population profile is quite different. And we don't yet have data that tells us whether Omicron has really taken off in those areas. So that's a big unknown for us, whether that could, really represent a coming uptick of cases again, if those communities begin to be more affected. And we, again, like our Western cousins and neighbors, suffer from a real lack of transparency of data coming to us from the government so that we can really have that true sense that what we think is happening is in fact what's going on.
Yeah, I'll just add a little bit to that. In addition to what Jillian was saying about the very high hospitalization rates that we've had, that has been on a background of more staff shortages. This obviously is not at all unique to Manitoba. We're all facing that across the country. But, we have this steady, incredibly high hospitalization rate where there's constant emails going out, does anybody have any experience in anything that might be helpful? That's pretty much the level that it's gotten to, in terms of helping for nursing staff and physician staff on the wards and on the COVID wards in particular as well. And we have lots of redeployed staff, which has impacted on our ability to provide services outside of COVID. Again, I'm sure this is not new across the country. And in terms of the comments about lack of transparency, it seems recently here like it's almost gone beyond lack of transparency to an effort to deliberately minimize the problem. They've changed the way, there's been this ridiculous debate here in the province with COVID or for COVID, trying to basically minimize the picture. And if you can't see it, it's not here. And I think that's even more of a change that we're having that has made it very difficult to try to maintain interest, if you can call it that, in vaccination uptake for third doses. We do hear about third dose fatigue, and yet we know how necessary they are, and interest in the constant problems about more restrictions, school issues, contact tracing, which has gone completely out the window, I think, in this province as well. Nobody's trying anymore, which is hard to fathom. So it's everything is happening on a background of 2 years of fatigue on the part of staff and patients as well, I think.
It's really quite heartbreaking, I find, as a human, desire to bury our heads in the sand sometime, as opposed to care for our neighbors and our loved ones in a way that is dignified and respectful and valuing that the human condition and the need to protect each other in order to have a truly functioning civil society.
Mhm.
Um, thank you very much for those words, Dr. Peshkin. It's,
Yeah.
it's,
You know,
it's this
Michelle,
ongoing tragedy. Yeah.
just as you make those comments, what I find myself thinking about, and in terms of Dr. Peshkin's description, is a couple of weeks ago, our premier made a remark that, again, we're starting to hear trickling out in public health messaging in other provinces, or we already have heard. But the comment was essentially that it's up to Manitobans to look after themselves, and the government can't protect people. And, it's true that when we are healthy, when we have privilege, when we have resources, we do have, a significant locus of control. There are certain things that we can do to protect ourselves. Many people don't have those privileges. And the second piece, of course, to that is, it's pretty hard to protect yourself, take care of yourself, look after yourself when you need to be on a ventilator. You can't intubate yourself. You can't operate on yourself. You can't prescribe and administer your own intravenous antibiotics. And so we can say that as, a directive, as a philosophy, but in translation, it seems maybe like an actionable idea outside the walls of a hospital. Well, go inside the hospital and we look at how sick people are, how very much people need right now to be done for them. And as Dr. Peshkin said, not just people sick with COVID, but people with all of these other problems that have been neglected and, not getting treatment because resources have necessarily been directed towards the crisis. The idea, the concept and the reality, one is just words, but putting that into action is really impossible. And the people who do that caring and that looking after at the end of the day are healthcare workers, essential service workers, and in education, our teachers, are carrying so much on their shoulders right now. So just the particular heartlessness of that messaging, it has struck me so often that this is not who we are. And I do not accept, and I don't think any of us who continue to speak out, from physicians all the way to citizens who are, expressing their thoughts, this is not what we've become. We are better than this. We are more than this. And we cannot accept this messaging.
As we find ourselves in this really timely and heartfelt conversation at this moment, I'm going to bring Dr. Wong back in as well, because I think even definitely from my place in Alberta, that other prairie province jurisdictionally, in addition to that fatalism of let her rip, you'd spoken a lot about the information that you're not receiving as humans from the folks who are making policy and from the folks who have that data, which sort of double edges that moral injury of make the best choices for yourself, be responsible for yourself. I am yet to fathom as a human how I can do that when when a full picture isn't shared with me.
No, I just again, I listened to Christine and Jill, and I just was just like, yep. So again, my day-to-day work as an infectious disease physician is mostly, in the space where I look after persons who are living with HIV, viral hepatitis. I also do like full scope addictions medicine practice, and so and infectious diseases predominantly affect those who are marginalized, who are vulnerable, and who our society has kind of forgotten about. And so I just feel fundamentally that our role here is to advocate for those people that do not have the means to be able to advocate for themselves. And so on the one hand, I really do understand how fatigued everybody is with all of this. At the same time, as Jill said, it feels like we've become an uncaring society when we just allow basically those that don't have the means to be able to make those decisions for themselves, and again have the power, the privilege, the finances, and the wherewithal to be able to make those types of good decisions. All we're doing is we're just advancing a certain agenda for those in power and those who have privilege, and we keep pushing everybody else further and further to the fringes. And for me personally, as a professional, that just hurts, because when you give your life to try to help people, who don't necessarily have the means to be able to help themselves, and you try to advocate for them in ways, sustainably so that the system can support them. This feels, again, very much like we've kind of given up on them. And it's just, it feels hard to accept. I don't want to accept that. I want to keep trying to push in ways that are going to be productive and are going to help support those people who need us.
One of the goals of our briefings is always to, in addition to the transparency, is to take questions from folks at home and from the media. That way we can fill some of that gap that is happening with that information dissemination and try to find ways to access folks who need it. So we have a couple of media on deck with us right now. And so I would like to bring Zach Vasera from the Saskatoon Star Phoenix into the conversation. Zach, thank you so much for joining us. Feel free to address your question to whomever, and feel free to ask a follow-up, and thank you for your time today.
Oh, thanks for having me. I'm a newspaper reporter, so it's very weird to see myself in any kind of image. This is terrifying for me. I have a question that I think could honestly probably just be pretty open. One line of rhetoric we're hearing more often here in Saskatchewan, and I think in some other Canadian provinces, is about living with COVID-19, sometimes put. There's this idea that it needs to become more of a personal risk calculus in a certain type of way. This is going to be an endemic disease in the long run, and we can't rely on constant societal disruption to kind of stop it. And I feel like most experts I speak to agree that this is going to eventually become endemic. The difference seems to be on the path of how to get there. And I wonder what you folks would make of sort of the rise of that rhetoric and how it should be interpreted, what you think the end game of this is. Big question, I know.
I'll just say, it's not an area of expertise in terms of, I'm not an epidemiologist in that sense, endemic versus pandemic, but that is a difficult thing for me to hear because my patients, as immune compromised individuals with serious chronic diseases, don't have the ability, well, their risk calculations have been live in a bubble. And rightly so. They don't have any better ability to protect themselves. So, and we've all been, living with lots of restrictions and none of us like it. We're all tired of it. We've got mental health issues related to it. But I think that is, you get magnified for our compromised patients. And we're not yet at the stage where it's safe to say we're not out of a pandemic. It's not, we're not there yet. So it's premature, really. And it's very hard to hear at this point because it really puts them at risk. And we have been seeing that certainly in terms of mortality. We've been seeing it in terms of hospitalizations. And I'm certainly also seeing it in terms of mental health. They have been, so that's just my take on it, that it's too soon.
Jill, did you want to go next?
Yeah, and then I think we'd leave some of the expert nuance to you as well, Alex. But, just a couple of things echoing what Christine said. One thing is there's a little bit of gaslighting involved here, right? The idea that we're talking about learning to live with this, moving to an endemic state. Let's take a step back and say, our hospitals, make no mistake, are in crisis. They're in perpetual crisis. As Christine said, as Alex has said, is the same thing in Saskatchewan. This has been building for 2 years. So you don't decide that you're going to shift to a tolerance strategy and a every person for themselves strategy when you're still in the middle of an active crisis in one of the main things that props society up. Now, you don't think healthcare is that important if you don't need it, or perhaps if you have very deep pockets and know that you can get on a plane and travel over a border and go somewhere and pay for it yourself. But I think one of the things that engenders humility when it comes to looking at uptake of, what a real crisis is, defining the severity of the problem, what kind of challenges have you had in your own life? If someone that you love has lived with the kind of chronic disease that patients like Christine's live with, or if you yourself have ever had something, or if you're just a person who is really aware of the randomness of the hand of luck, you look look at this and say, our health system is so fragile right now that tomorrow, if I found a lump in my breast or an artery ruptured in my brain, I couldn't even count on the services being there necessarily. Now they're there. I don't, again, because that's where people say, well, it's fear mongering. Yes, you can go to a hospital, be seen by the appropriate physicians, but let us all be very clear. When the system is completely overloaded, the care is not the same. When you have one person who normally looks after one patient in an ICU, and now they're looking after two patients, or maybe they're even looking after four patients in a modified setting, who among us would ever pretend that a job that is normally so intense that it takes one person to do with one patient, when you begin to spread that out, the quality is not the same. There are delays finding beds for people, getting them transferred, because our ambulances are busy transferring people all over the province in Manitoba right now. Our elders sometimes can find themselves in a transport van going 6 hours from the home where they live so they can complete their hospital stay. And so we just have to recognize that without healthcare, if we don't need it, we don't think it's a problem. The moment we need it and it's not there, we suddenly realize that it is one of the most basic aspects of, the assumptions that we build our society on. So I think that's another piece of this idea of when we move to saying learning to live with it, it's endemic. It's just not reality based for anyone who has a healthcare condition or who may have one in the future and just doesn't know it yet.
Yeah, so just I could go on for an hour about the answer, but I'll just echo what Christine and Jill started to say. I think it's first of all, it's just kind of amazing to me how we've somehow managed to just pretend that everything going on in healthcare is just fine. I don't even know how to fathom this in my own mind in terms of what is happening in hospitals and the just utter crisis that's happening, and the degree of moral injury and damage that has occurred with literally every single person that I work with every single day. And yet we somehow just ignore all of that as if it's not a problem. And this it's going to just, again, be a cumulative toll that is going to not be something that we're going to be able to recover from. But to answer your question, Zach, I think at the end of the day, there is a hope that I think many people have that this will be the last wave. And again, I think as our knowledge has grown around Omicron, and as we see potentially emergence of like a different lineage of Omicron, and we just kind of recognize how Omicron may potentially have come about in terms of either in an animal vector or possibly in a heavily immunosuppressed individual. At the end of the day, I think the sad reality here is that it's not over, and the very likely realistic possibility, which is not me, I'm just a simple clinician, but I think very, very smart, intelligent virologists basically are almost 100% convinced at this stage that if we don't have much greater significant vaccine uptake in undeveloped and third world settings, there will be another wave. And I mean, it literally has only been, like, I remember 2 months ago, I was on a plane to Vancouver, my first flight in 2 years. And I was reading about this Omicron thing. And now here we are, like 2 months later, and it's completely destroyed our society, and completely transformed everything. So people say that that's doomsday thinking, and that's not going to happen. But honestly, every single time people have predicted that the pandemic was going to be over, it just wasn't. So unfortunately, the virus doesn't care. And I appreciate the fact that we do need to move to some new normal. And honestly, I think when Omicron is done in most of the developed world, we're going to see what that new normal looks like, because there just probably isn't a tolerance for the same degree of, restrictions and measures as there was, say, a year and a half, 2 years ago. But that doesn't mean that we can't just not continue to maintain significant diligence around everything with regards to COVID. There's so many things we don't know and understand: short-term, long-term impacts of COVID, the impact of letting so many kids, literally like every single child unvaccinated, be infected with COVID is just so incredibly scary. And all of the muddled messaging that we have, all of the challenging rhetoric that we're trying to deal with right now, where it seems like anything that's public health and scientific and evidence-based is now being labeled as extremist or doom mongering, or whatever term you wish to use, fear porn, and so forth, is just really difficult to overcome. So we need to try to all get on the same page with regards to our messaging. But that is a challenge, I think, when we have our elected officials essentially message the idea that it's done, we're done, and good luck to everybody.
Zach, I'd love to offer you the opportunity to ask a follow-up. Panelists, I'm just going to mute all of you because we are experiencing a teeny bit of feedback. So whenever you take the opportunity to respond to Zach's question, please just unmute yourselves and then remute when you're done. Zach, do you have a follow-up?
Thanks so much. And maybe I'll direct this one to Alex. Sorry, Dr. Wong. About it, and it kind of has to do with the kind of fear porn that you just mentioned, and usage of terms like that. And this is a question really about crisis communication. So please just let me know if you're not comfortable answering it. But we hear the word, and this was touched on earlier, we hear the word lockdown a lot now. We hear it a lot more than we did even in the earlier phase of the pandemic, where we had way stricter, like, actual restrictions going on. And it's used kind of interchangeably sometimes, I noticed, from from our political figures. Premier Scott Moe, as you know, was doing a press conference earlier this week, and he was asked to define a lockdown. And his answer was basically that it is relative and that it is totally up to an individual. But I wonder what you make of, like, the constant use of that word recently, because forgive me if I'm wrong, when I hear you talk about this, when I hear infectious disease people talk about this, I don't necessarily hear anyone advocating for wide-scale closure of all businesses like we had in the spring of 2020, right? So what do you make of this and what's going on? What are you actually kind of asking for?
So thanks, Zach. So to make it blunt, again, I mean, I think using a term like lockdown essentially triggers a certain type of psychology people have around, limitation of freedom, and again, restriction of your liberties and your rights and all of these other things. And that is not the intent here. The intent is to figure out ways to slow transmission of the virus by limiting overall social contact, especially when we're in a surge period like we are right now, to try to spread out the amount of transmission so that we don't have such huge, significant surges that occur, such that our hospitals and ICUs are overwhelmed. The entire goal is to slow down transmission of the virus. And again, I prefer the term measures because I don't feel that the term measures necessarily triggers to the same degree, but our premier seems to prefer to use that term lockdown for whatever reason. Again, the idea of lockdown to me is not about restricting, restaurant capacity to 25% in indoor space. And again, I mean, the premier made a comment earlier this week with regards to how lockdowns, as you say, are different to different people. That is the truth. Some people might be very upset, for example, if their teenager is not able to go to an important hockey tournament. I would just say to that effect that I recognize that, and I am not trivializing the impact of policy on any given individual or any given family's circumstances. But at the end of the day, the reason why we're trying to do all of this is basically to minimize death and suffering. And essentially, when we're saying that the personal freedoms of a teenage hockey player, outweigh essentially that of, for example, a medically vulnerable individual or an unvaccinated 3-year-old, or, someone who can't access life-saving surgery or a procedure because our hospitals are full, that to me is difficult in my own mind to reconcile. I believe at a societal level that we have a responsibility to advocate for those who, are in those types of circumstances and to protect those that don't have the means to be able to protect themselves. So I'll just leave it at that. And to say that, I think the messaging from our elected leaders has been very clear at this point. I don't believe that there's going to be new measures or restrictions put in place at this point. What I believe that unfortunately means for our province is that we are going to have, again, significant case numbers, but more importantly and more problematic, we're going to have hospitalizations continue to grow over the course of the next couple of weeks. And it's going to be a real challenge for healthcare workers and for our system to absorb all of that.
Thank you so very much, Zach, for joining us for your questions today. I am going to bring in Alexander Kwan from CBC News. Alexander, feel free to address your question to whomever you so desire or the entirety of the panel. And thank you very much for joining us.
Hi there. I guess my question would be for Dr. Wong, but it could be open to anybody. I've spoken to a lot of parents after today's announcement who say they feel like they don't have any guideposts on what to do, on how to feel safe, and whether or not they can send their child to school now that reporting from schools is going to be ending as of tomorrow. I guess, what advice would you give to parents who are looking for some kind of guidance right now?
Thanks, Alex. So tough situation. And I guess the first thing that I would say is that, first of all, if your child is fully vaccinated, 2 weeks out from their second dose, and if your child has the ability to wear a high quality, ideally like some type of a respirator, but if not that, then a double mask with a good fit and a medical grade mask. And if your child is in a setting, where the classroom is well ventilated, ideally like a newer school, or if they've upgraded ventilation, that probably is going to be about as safe as it's going to be. The problem right now is that our Omicron surge is still occurring. It's a bit different depending on where you are in the province of Saskatchewan, and again, different for the province of Manitoba. So if you're in a situation where you're very concerned about the potential that your child might get COVID, again, without really any knowledge or understanding of what's happening around you or what's happening in the classroom, you sort of have to make a decision at this point whether or not it makes sense to you. If you want to try to avoid having your child get COVID for whatever reason, that's a personal decision, then possibly trying to keep your kid out over the course of the next 2-3 weeks, or do remote, while we crest and come down, so the amount of transmission is much, much less in the community, then it would be a much lower risk type setting at that point. On the other hand, if you're in a situation and fortunate enough to have your child be fully vaccinated, able to wear a high quality mask, ideally a respirator, and be in a well ventilated setting, then honestly, your child is probably relatively safe, despite the significant amount of community transmission occurring in Saskatchewan right now. I think that would be, again, an individualized discussion that you would have to have with your child around the benefits of being at school versus choosing to go remote or online over the course of the next 2-3 weeks. So it's hard to provide more general guidance other than for that. I think it, again, depends on every family's individual degree of risk tolerance. I mean, I don't want to be a fearmonger, but I've personally, and our family, we've been fortunate enough and privileged enough to have the means to be able to keep our kids home from school. And there's been multiple cases in my 5-year-old's class, as well as my 3-year-old's daycare room. And so almost assuredly they would have, been significantly exposed and probably infected, if they'd been there. So we all make individual choices, but go with what your gut tells you. Do the best you can to keep your kids safe. And you know what? At the end of the day, remember that, again, I don't want to minimize it, but COVID is relatively minor for the vast majority of kids. If you need to make that decision to have your kid be at school or at daycare for your family circumstances, protect them as best you can and be okay with whatever happens.
I'll just add that I have to say, on a personal level, I've been so happy that my children are adults. I haven't had to deal with homeschooling. I haven't had to deal with these questions. But other than that, I think it's exactly the same here in Manitoba, that parents really don't know what to do. There aren't any guidelines. All of those really excellent points that Alex made, often the parents don't seem to know the answer. We had discussions and here around school ventilation, and a lot of the ventilation is not good in the older buildings, has not been improved. Mask access is not always great. So it is a difficult situation. And again, from my lens through which I'm seeing this, I have the added problem that my patients are wondering if it's safe to send their kids to school, not for their children's safety, but knowing that there's a significant chance that they may bring COVID home, and then what happens to them. And that's been an extremely difficult problem for them because they are well aware of the mental health effects on the children, aside from any other effects of keeping them home even longer now that schools are open. And yet sending them to school may, open up family members to really quite significant risk of poor outcomes from COVID. So it's just been so difficult. And, I think Alex's answer was brilliant, and I can't add to it, but it isn't exactly clear cut. There just is no clear cut answer right now.
And I would just agree 100% with what you both said. And I would also just say, it makes me so angry, that this is put on the shoulders of parents. We've heard about this movement recently, the urgency of normal, and a group of largely American physicians with a Canadian physician, I think at least one as well, advocating for the removal of masks and, returning to a normal state. Well, what about the urgency of mitigation? Imagine if last summer, every province had committed to making schools as safe as possible. As Alex said, we can never make them perfectly safe at this point, but we can certainly make them as safe as possible. And then parents are choosing from an option where at least it's not all on them. They could know about the status of ventilation. They could know that teachers that the teachers around their kids were vaccinated. They could know, about the quality of the masking and all these things. And instead, what's happened is it's all on the parents. And as Alex said, just for interest's sake, I've done the same thing as Alex. I'm also fortunate to be able to do it and keep my kids home while the cases are really high. Some of my colleagues have had to or sent their children to school in the last few weeks, and some of them have contracted COVID. And again, as Alex said, for most kids, COVID as an illness in the acute phase is going to be really mild. And I think there's always been a bit of a misconstruction in terms of those of us who are really concerned about, as Alex said earlier, just massive cohorts of kids all being exposed to COVID. Whether we like it or not, we can say at the time that it is, in the vast majority of kids, a mild infection. It has not been around long enough for us to be able to say what the long-term consequences may be, just as Alex said earlier. So very often, this narrative kind of gets spun that people say, well, COVID's mild and for most kids, so therefore people who are raising caution and concerned about it and pushing aggressive mitigation, they're just fear-mongering. We don't know. And again, it comes back to that humility piece. We're seeing more data coming out about, for example, potentially higher risk of diabetes in kids in the future if they've had COVID. This disease has not been around long enough for us to be able to make any meaningful statements about what the long-term implications may be for some people of infection. And therefore, why not push that mitigation, do everything in our power to make the schools as safe as possible? I've often said that I think if this were a disease affecting primarily politicians in midlife, we would be pulling out every single stop to keep those folks safe. We owe the same thing to our children. And then, you make it at least easier for people to make the decision that's right for them. I think there are a lot of folks who, if they knew that their school had top-notch ventilation, N95s available, as good of a plan as possible at times when kids would be unmasked and eating, as much outdoor education as possible, then I think many people would be saying, you know what, I'm going to send my kid, because we all agree school is really wonderful for kids and beneficial to their development. I don't think there's really anybody in among expert voices who disagree about that. But where we do find ourselves having different perspectives is, make the schools as safe as possible. And then people will be able to make the choice that fits their family instead of having to stay away from school because of some of those other factors that Christine mentioned that can come into play for many, many families.
And for folks at home who are watching, I would just like to add from a non-medical perspective, from a perspective of someone who's had the privilege of spending the last 5 months talking to a lot of humans who have experienced this and a lot of families who have had COVID in their home. a lot of parents have expressed concern post-COVID exposure about not being ready for COVID exposure to have happened in their home.
Mhm.
And the folks who have sort of pre-mapped out what that might look like for them in terms of mitigating spread in their household, in terms of simple things like making sure their thermometer has good batteries, has really helped alleviate some of that stress if it is to happen. Because I think, unfortunately, for a lot of parents, I know myself included, even though my kids are older, when one of them was COVID positive, there is a lot of guilt on the parent part. And I think it's important to remind everybody at home, you whatever choices you make are the right choices for you at that moment in time. And so having that pre and post plan just in case seems to save a lot of people a lot of heartache and heartbreak as they have to go through the challenges of living with a COVID positive case in their home.
Mm.
Alexander, do you have a follow-up question?
I do. This will be for Dr. Wong. Cases are going up, hospitalizations are going up. What kind of effect do you think that this morning's policy changes will have on those metrics?
Dr. Wong, you are currently muted.
Thank you, Michelle. Such a pleasant voice, Michelle. So to make a long story short, Alex, it's hard to know what the immediate impact will be. I mean, truthfully, it's probably going to be relatively minor in the grand scheme of things because there is significant widespread community transmission of Omicron. We know this. I think the challenge here is that given the fact that we're literally right in the midst of the fire that, you know, the province is dealing with right now, the fact that we don't expect hospitalizations and ICU admissions to crest probably for the next week or two. I mean, I hope I'm wrong, and I hope those numbers turn around really, really quickly. I just don't realistically see that happening. And again, we see different dynamics in the urban centers of Saskatchewan, so Saskatoon and Regina specifically, compared to the rural centers. I think the rural centers have yet to really feel a significant surge of Omicron. And unfortunately, when people get sick in those rural centers, they're all going to get funneled again to Regina and Saskatoon predominantly. So it's going to be it's going to be a challenging piece over the course of the next 2-3 weeks for us. And frankly, I wish that the government would have just given us a little bit more time. Because again, when we're right literally in the midst of it, when all of the modeling that we have shows that when we don't have measures in place to significantly reduce the amount of close contact and contact amongst humans, and when we are actually making and loosening our isolation measures and protocols right in the midst of all of this, you know, in this kind of rush to normal or urgency to normal, as Jill put it, which is kind of trending right now, that's just going to add sort of fuel to the fire. And it's not obviously going to be a positive thing for our hospital system, our ICUs, and, for the general crush that we're going to feel for healthcare workers. So I realize, I understand that this is going to be our reality in the near future. It just would have been ideal, I think, if we could have waited a bit longer, like 4 to 6 weeks, when we could have been through the worst of this, to let it go, as opposed to literally having it happen like right now. But, I'm not the one that makes policy.
Thank you very much for joining us, Alexander. As we move into our last few minutes together, I would love to take this opportunity to ask you all to share some sort of closing thoughts, whether or not they be about your jurisdiction, whether or not they be about the country from coast to coast to coast, anything that you would really like to send out into the universe to hopefully see continued as we make our way through this current wave.
Do one of you ladies want to begin?
Well, what I find myself thinking about is this seems like, approaching the 2-year anniversary of this being the reality of most of our lives as clinicians, as parents, as community members. I sometimes wish we could all just hit the pause button for a moment and just look back and think, I mean, we have been through so much collectively, all of us, every single person. No question, some people have been through more than others, but it's been hard for every single one of us. And I just wish, as we see, the way that the rhetoric has increased so dramatically, and also, how people's indifference has increased, and this idea of I'm with it, I want to go back to normal. I sometimes just wish we could have a collective just moment of reflection. We've done a lot. We've gotten through a lot here. There are some things that our country has done really, really well, that our communities have done well. And, even some of these places, I am from rural Manitoba myself. That is where I grew up. And, even though sometimes our rural areas are when we see certain ideas and philosophies entrenched, I also know the kind of people who come from those communities. They are good people. They're people who care about each other. They're communities that care about each other. And what I wish is that we could all take a moment, reflect, commit to those qualities that are within us, that are embedded, are obvious to anyone who knows the communities that we are from, the kind, the best parts of ourselves, that we could just recommit to bringing those parts back into the discussions, into the decisions, into the policies, to the ways that we speak to each other. If I had just one wish coming up to our COVID anniversary, I think it would be for all the good things about each other that we know are there, to just manifest again, because I think in some of the heated discussion and polarization, we've forgotten how to really see each other, and it's very poignant.
Yeah, I have to echo Jillian's eloquence there. It's really hard to build on that. I think it's also worthwhile, though, to look at some of the progress that has been made. It's been I think this last month, everybody's been pretty despondent because we keep thinking it's going to get better, and instead here we are again, and we're not done yet. But at the same time, we are so much farther ahead than we were a year ago. I know there's all this talk about lockdowns and restrictions, but we are much less restricted, even outside Saskatchewan, than we were. And we have learned so many new things. We have so many tools, more coming. I mean, now there's an Omicron specific vaccine that's coming within the next couple of months that we hope will make a further difference. I mean, the advances on the medical side have been amazing, but there have been also so many examples of people pulling together and coming up with innovative solutions to many things. And I do think it's important to focus on that as well as we go forward.
Thanks, ladies. I'll just kind of finish off. I don't have anything particularly profound to say, other than for the fact that, again, I think, the three of us, I'm maybe being a bit presumptuous to speak for the two of you, but we went into the profession of medicine to care for people and to advocate, for those who are under our care. There has been just a lot of anger and a lot of rhetoric and a lot of hate, that has kind of just festered over the course of the last, it feels like it's been, particularly bad over the last month or two. And I just feel collectively, again, I mean, this is not what this country is. This is not what our provinces are. Like, this is not why I came to this province. Like, I'm a Torontonian, right? Like, how the heck did I end up in Saskatchewan, in the prairies of all things? I came because, I met so many caring, wonderful people here who just fundamentally just cared about one another. And that's what this province is. That's what Manitoba is. That's what the prairies are. And, it's somehow morphed into this very challenging sort of dynamic that we have right now. So at the end of the day, I think for my province, at least, our provincial motto, when you translate it, it's from many people's strengths. And it feels as though a lot of the messaging that has come from our elected officials over the course of the last couple of months has not necessarily sought to bring us together and to unify us in some sort of humanistic way, but rather to try to create more division and to create more anger and more hate. And I think we need to move away from that and move to a place where we can just remember our common humanity and look after one another as human beings. That's why we're doing what we are as healthcare providers. And it doesn't matter, again, like whether you're vaccinated or whether you're not vaccinated. It doesn't matter whether, you believe this or you believe that. Like at the end of the day, our responsibility is to look after one another. And frankly, the measure of society is frankly how it looks after its most vulnerable. And that's what we will continue to advocate for, because we don't want to willingly allow at least, the most vulnerable and the most marginalized in our society just be left behind, as it feels like they are right now. So we just need to continue to work and push towards those ideals and try to remember, what it is that brought us to this point, personally and professionally.
Thank you all so very much for joining us today and for your eloquent, articulate, passionate words. It is so evident to me how much the three of you truly care about those you serve and society as a whole. So thank you so very much. We will be back again next week. Until then, have an excellent evening and stay safe, Canada. And as always, remember, COVID-19 is airborne. Wear the best mask with the securest fit you have access to. Vaccines really do save lives. Thanks again.